Hello everyone, welcome to the module on the cardiovascular system. In this module, we will talk about aortic aneurysms and aortic dissection. Okay, now let us start with aortic aneurysm. Aortic aneurysm is basically a balloon-like dilatation. It is a balloon-like dilatation of the aorta. Is this clear? It is a localized pathologic dilatation. Now, it is majorly presented with abdominal or back pain, which is a sign of its further complications, that is, leaking of the aortic aneurysm or dissection of the aortic aneurysm or imminent rupture. That means just a rupture of aortic aneurysm. Now, due to these three, there can be abdominal or back pain. Is this clear? Now, talking about the two types of aortic aneurysm, that is abdominal aortic aneurysm and thoracic aortic aneurysm. The first one, abdominal aortic aneurysm, is associated with atherosclerosis. That means excessive deposition of lipids in arteries of the body. Is this clear? Correct. Now, the major risk factors include tobacco use, increased age and male sex. Okay, so if a male with smoking comes, it is at a high risk of abdominal aortic aneurysm. Is this clear? Now this may be presented with a classic symptom, that is a palpable pulsatile abdominal mass. Okay, so whenever there is a palpable pulsatile abdominal mass and the patient is a aged male with excessive atherosclerosis or with a history of smoking, then it is usually abdominal aortic aneurysm. Now, in the CT scan, there is obviously presence of calcification of the aortic valve with a crescent-shaped non-opacification. There is a crescent-shaped non-opacification. Is it clear? And it is mostly infrarenal. That means the abdominal aortic aneurysm usually occurs distal to the origin of the renal arteries, and after the it is before the aortic bifurcation. Is it clear? So it is between the renal arteries and the aortic bifurcation. Remember that. Now, talking about the second one, that is the thoracic aortic aneurysm, it is usually associated with cystic medial degeneration. Now, cystic medial degeneration is a histologic finding of connective tissue diseases in which the arteries are damaged, and there is a classic finding, that is a cystic medial degeneration. Is this clear? So, thoracic aortic aneurysm is presented by cystic medial degeneration because the risk factors includes hypertension, bicuspid aortic valve and connective tissue diseases. Is this clear? So it includes bicuspid aortic valve, connective tissue diseases and hypertension. Now, aortic aneurysm, that is the thoracic aortic aneurysm, is also associated with tertiary syphilis. Now, whenever it is associated with tertiary syphilis, there is a classic tree bark appearance. Tree bark appearance. Please remember that. Is it clear? Now, due to tertiary syphilis, there is a obliterative endarteritis of vasa vasorum, which causes the tree bark appearance. Am I clear? Now, due to excessive aortic root dilatation, it may lead to aortic valve diseases like aortic regurgitation. Hence, thoracic aortic aneurysm is associated with aortic regurgitation. So it has majorly three associations, that is connective tissue disorders, it is associated with tertiary syphilis and aortic regurgitation. Is it clear? Now, talking about traumatic aortic rupture, whenever there is a trauma or a crush injury or a decelerated injury, it majorly leads to effect on the aortic isthmus, aortic isthmus. Am I clear? Now, aortic isthmus is the proximal descending aorta, which is just distal to the origin of the left subclavian artery. And in traumatic aortic rupture, it is the mediastinum is widened. Am I clear? So we have covered the aortic aneurysm part. Now talking about aortic dissection, which is a majorly tested topic on the exams. Aortic dissection majorly means intimal tear. That means the intima of the blood vessel or the aorta is torn, and the blood, due to excessive pressure by the left ventricle, leads to a formation of a false lumen. Okay, so let me just zoom into this diagram. Whenever there is excessive blood flow coming from the left ventricle or there is hypertension, there can be tear of intima and hence leads to formation of a false lumen. Is this clear? Now, it is majorly associated with hypertension, bicuspid aortic valve and inherited connective tissue disorders. That means it is also presented with cystic medial degeneration. Is this clear? Now it can be presented with a classic presentation of tearing, sudden onset chest pain which radiates to the back. Okay, so whenever the person comes with excessive sharp chest pain which acutely start, then it can result in aortic dissection. There is also unequal blood pressure in both arms. Now when you see it under a chest X-ray, there is mediastinal widening. Okay. Now, due to aortic dissection, there can be organ ischemia, aortic rupture, and hence death. There are majorly two types of aortic dissection, that is Standford Type A and Standford Type B. In Standford Type A, ascending aorta and the descending aorta, even the arch of aorta, all of them are affected. Okay, whereas in Standford Type B, only the descending aorta is affected. Now, in Standford Type A, there can be acute aortic regurgitation or cardiac tamponade due to this aortic dissection. Am I clear? Whereas in Standford Type B, there is nothing like that and there is only the effect on descending aorta. Is this clear? Now, Standford Type A is treated by surgery, whereas Standford Type B is treated by beta blockers and vasodilators. Now we have already spoken about aortic dissection, aortic aneurysm. Okay. Thank you for watching this video. If you enjoyed the video, please click on the like button and do subscribe to this channel. Let me know in the comment section below which topics do you want me to explain. Thank you.